This is all over the headlines in the United States. It's a fast-growing outbreak with an unknown source, no traceback, and no clear advice to give. So Cyclospora, just a little bit on it. It is a parasitic protozoal infection spread by produce. It is a produce infection, and that produce gets contaminated when water that's used for irrigation has human fecal matter in it. And it's been surging across the United States this summer. Michigan closing in on 2,000 cases. They've got several dozen people hospitalized. This seems to be 4 times higher than their report last year. There are 16 other states that are reporting cases of Cyclospora, and they can't name a common source. What we do know is that there doesn't seem to be an international travel link to this major outbreak. People who travel to areas where Cyclospora is endemic in Central and South America, yes, they can bring back Cyclospora, and that seems to be accounting for a lot of the cases in California, but not this Michigan outbreak. We are in peak season, spring and summer, and that's normal. But what's abnormal is that no one can identify the source. So there's no concrete avoid this to tell people. What do they do? What do they not do? We know in the past, raspberries, basil, bagged lettuce, those are things that people can avoid. Yesterday, I was at dinner with people and they weren't eating the lettuce on their plate because they're scared. So this is something that is changing people's behavior. And unlike Salmonella or E. coli, Cyclospora doesn't have an easy genomic traceback. Sorting its genetics was likened to reading War and Peace versus a quick read by an expert. The other thing about it is that we have this surveillance system called FoodNet. It's been scaled back significantly since July 2025. This is run by CDC. Now they're really looking only at Salmonella and E. coli. Cyclospora is optional. What role that plays, it'll be clear. It's unclear at this point what role that scale back played. Obviously, it didn't help the matter. And the fact that the CDC's reporting lags the state's reporting also is a problem. The treatment for Cyclospora is Bactrim, but oftentimes diagnosis is missed because people don't order the proper test. It's a specific stool test. And this can be prolonged and severe in the immunocompromised. This coincides with the World Cup. I don't know that there's any linkage with the World Cup. It hasn't really impacted the World Cup, but expect it into the headlines until the driver is found.